In this series of videos, we are going to focus on Lab 2, the blood vessels. So all of this that you see on the list, with the exception of the bottom down here, these are actually nerves, two nerves that you need to recognize. But all of these are going to be blood vessels. So to get started identifying blood vessels, the best thing to use, at least in my experience, is a probe, okay? We don't want to use a scalpel. You could also use the blunt end of the scissors if you wanted to, but I recommend just using the probe. And all we're really going to be doing is isolating the blood vessels. We're just going to be peeling away the connective tissue in order to expose the blood vessels. So if we open up his neck a little bit here, you can already probably see some of these vessels. And down here on top of the heart, when we removed that thoracic thymus in Lab 1, we exposed the superior vena cava. All we really want to do is to start to follow these veins and isolate them so that we can see them better. So I'm going to roll the thymus gland over a little bit, and I'm just going to start to move back and forth some of this connective tissue, and I'm going to go on either side. Once I start to see the blood vessel emerge, I'm just going to start kind of sweeping back and forth on either side of that vessel just to expose it so that we're able to see it more clearly. I mean, look, just within a matter of seconds, I'm able to see a vessel right here. I've got a vessel right beside it, right here. And then a pretty good blue one right here. So it really doesn't take much to be able to see these. Okay, so just use that probe if you're doing this dissection yourself and just sweep some of that connective tissue back and forth. And when you start to see a vessel, just stay on either side of it, the top and bottom of it. Okay, so I've got his right side fairly cleaned a little bit. So let's work over here to the left. So we're going to start right here. I'm going to be on his left side, and you're going to see this most medial blue vessel right here. This is called the left internal jugular vein. The left internal jugular vein. This vessel right here next to it, that's more lateral to the outside, that's called the external jugular. So there's our external jugular vein on the left. Then there's another one that's coming out here to the shoulder. This is called the transverse scapular vein. Now, I don't put this on test, so I wouldn't, necessarily worry about that. Most students end up breaking it, to be honest, because when we get out here in the arm, this tears very easily because there's a lot of tension that's put on it. So this is the transverse scapular, but we're not going to worry much with it, okay? Then as we continue to move out in the arm, we want to find one called the axillary vein. Now this one is going deep, so it looks like I might need to do a little bit more cutting. And already, just kind of cutting some of that skin, you can see there is another blue vein right here coming out into his arm. This is known as the axillary vein, okay? So we've got internal jugular, external jugular, transverse scapular, and axillary vein. So over here on his right side, internal jugular, external jugular, transverse scapular, axillary. Now all of these veins are draining deoxygenated blood. So blood is actually moving toward the heart in these vessels. And they're all merging with large branches off of the superior vena cava. I'm kind of shoving that thymus gland up out of the way. Branches of the superior vena cava called the brachiocephalic veins. The brachiocephalic veins is this really thick branch right here. It's really thick. And all of these smaller ones that we just named, the jugular, scapular, and the axillary, they're coming off that brachiocephalic branch. Okay? So this is the left brachiocephalic vein, and this would be the right brachiocephalic vein. And these drain into the superior vena cava, which is this guy right here coming directly off the heart. All right, now under the heart is the inferior vena cava. If I lift the heart up a little bit, move that pericardium out of the way, you're going to see there's another blue vessel right here. I'm going to try to lift that heart up. Right in there, that's the inferior vena cava. Now this is going to be draining blood back to the heart from the abdominal organs. So all the veins down here, they merge with this inferior vena cava, and it all comes and dumps into this right auricle right here. Okay, now we're going to focus on the arteries that are found within the cervical region and then in the thoracic region as well. Okay, now arteries carry blood away from the heart. Now, the arteries should be stained pink in your pig. Sometimes the stain does not pick up very well. And unfortunately, in this pig, I don't have a great pickup of that stain. So a lot of the arteries here appear more of a white or a fleshy colored, but I'm going to do my best to put the arteries under the probe and kind of wiggle them around so that you'll know exactly which vessel I'm talking about. Okay, now we're going to start down here at the heart and then kind of work our way out into the tissues, since blood goes from the heart out to the tissues. So this is our heart. These are our auricles, right auricle, left auricle. And you'll notice there is a nice big vessel right here between your auricles. This is known as the pulmonary trunk. The pulmonary trunk is an artery. It's carrying blood away from the right side of the heart to the lungs, which is why we use that term pulmonary for it. So pulmonary trunk is here. Now above the pulmonary trunk, I'm going to kind of squish the heart down a little bit and try to move these lungs out of the way. The aorta lives right here above that pulmonary trunk. So this is the pulmonary trunk. This is the aorta right here. I'm kind of running that probe over the top of it right here. Okay, let me see if I can zoom in on the video a little bit, and maybe that'll help to see that a little bit better. So this is the aorta. Okay, now the aorta has three regions to it. There is an ascending aorta that comes directly off the heart, it's coming from the left ventricle, ascending. Then there's an arch right here at the very top, kind of this little rainbow arch of the aorta. And then it continues down the back body wall of the thoracic cavity, down to the abdominal cavity, as the descending aorta. So it's kind of tough to see, but it's coming right down here. Actually, if I roll the lungs over, I don't know if you guys will be able to see this very well either, but we're going to give it a go. If I roll the lungs over, you can see, I think, yeah, you can see a pretty good view of this. That's actually the descending aorta right here, that white one coming down the back. And we actually identify that descending aorta as the thoracic aorta when we're up here, and then when we're in the abdominal cavity, we call it abdominal aorta. Okay, now coming off the aorta, back up here at the top, coming specifically off the arch. So here's our arch. There are two large branches. There's one here, kind of got my probe under it, and there's one here, right there, okay? This one that comes off first, more medial, kind of right up the midline, is known as the brachiocephalic trunk. Okay, now this is an artery, brachiocephalic trunk or brachiocephalic artery. Now remember, there was another word called brachiocephalic up here in the veins. These are the brachiocephalic veins, right and left. This is the brachiocephalic artery, okay? Or a lot of times we just call it brachiocephalic trunk. So as we come up, that brachiocephalic trunk is going to branch 3 times. We're going to have a right subclavian and then 2 carotid arteries. So, and they're going to be kind of hard to see, the branches, because our veins are here. And we don't want to remove the veins because we're going to use those veins. We need to be able to identify them. So we kind of have to dig around these veins and try to search for an artery that's going to be coming out here to the side. And again, I'm just using my probe to kind of isolate and move some of this connective tissue around. Now here I am, I've got it. It's kind of deep, but I'm going to get my probe under it. This guy right here is called the right subclavian vein, artery. Right subclavian artery. It's coming off that brachiocephalic trunk. So it's coming up, we're kind of disappearing behind this superior vena cava and its branches, but it's coming up behind this, posterior to it, and it's re-emerging right here. and that's the right subclavian artery. Right subclavian artery, okay? Then we're going to continue our way around, and there's going to be another branch that appears right beside the internal jugular, and it's called the right common carotid. Right there. Right common carotid. And then there's going to be another branch called the left common carotid, and it's right beside that left internal jugular. Right there it is. Okay? And all three of these, the right subclavian, which was down here, kind of hiding, the right subclavian, right there, right common carotid, and left common carotid, right here, are all coming off of that brachiocephalic trunk, right down here. Okay? So brachiocephalic trunk, right subclavian, right common carotid, left common carotid. Now, if we look at the left subclavian, this is the left subclavian guy right here. Okay? He's going to come up, and he's kind of going to disappear behind these branches on the left side of the veins, and he's going to reemerge out here in the shoulder. Okay? So right here he is. I have a little pin right there to help hold him down. So right there he is. Okay? And as you're dissecting, if you're dissecting this yourself, and as you're dissecting, you're going to start to see little fleshy, maybe they look white, strings coming out in the arm. I left that on purpose so you guys could see it. These are actually nerves. Okay? Now, I don't ask any specific nerves coming out in the arm on test, so I'm actually just going to snip that off. And you can do the same on your pig, just so they don't get in the way and they don't get confusing. Okay? But right here is that artery coming out in the shoulder, in the arm right here. We're going to call this the axillary artery, and it's coming off of that left subclavian, which was down here. So left subclavian down here in the thoracic cavity, we're going to come up and around the ribs, and then we get right out here in that armpit area, shoulder area, we're going to call it left axillary artery. Now that axillary artery is going to continue out in the arm, and we had to do some dissecting. I didn't have that on the video. I kind of cleaned it up ahead of time. But you have to kind of cut out here in the arm. Use that probe, just follow it out here, clean everything up, and follow that axillary out in the arm. And then we're going to see two branches. Well, one branch and a name change, I guess we should say. Branching downward from that axillary artery is going to be the subscapular. Now, he's kind of small. I've got him under the probe right now. You can kind of see that little pink coming down. That's called the subscapular artery. It dives deep and heads to the scapula, which is his shoulder blades back here on the posterior side. So that's why we really don't see much of him, because he comes off that axillary artery and he dives down. Then as we continue past that subscapular branch, we're going to call this artery the brachial artery, because at this point we're out here in the arm. Okay? So we've got axillary artery coming out, then it branches down into the subscapular, and then there's a name change past that branch. We call it brachial. All right? So let's start down here from the bottom. Left subclavian artery, up and around, kind of disappears behind these veins. It re-emerges here. Axillary artery. Coming on down, there's a branch downward called subscapular artery. And past that branch, more lateral to that branch, out here, brachial artery. Now we're going to work our way into the abdominal cavity and identify some major abdominal blood vessels. So I'm down here, this is the diaphragm, the liver, just to give you guys a point of reference. And I'm going to kind of raise these up. Here's the intestines, spiral colon, small intestine. I'm going to roll these to his right side. So I'm mainly working down the center of the body cavity, and I've got the organs pushed over to the right side. And I'm going to use my probe to first try to find the abdominal aorta. And the abdominal aorta is going to be on the back body wall, and it may be hiding behind some of that peritoneum still. So we're just going to use the probe, and we're going to start cleaning, just kind of moving these tissues around. And as we start cleaning, we should start to see some vessels emerge. And I'm seeing a big blue one come through and a white one right beside it. Maybe, hopefully you guys can see that as well. So this big blue one that's emerging right here, that's part of the inferior vena cava. That's that same vessel that we saw up here under the heart. Right there it is under, whoops, I'm a little high, aren't I? Let me move it down just a smidge. Right here it is under the heart. It's going to go through the diaphragm and then come down and end up on this back body wall right here, that big blue one. So as I'm cleaning up some of this connective tissue and breaking through the peritoneum back here, I see that inferior, and then there is a nice big white vessel right beside it. That white vessel is the abdominal aorta. So I'm going to follow it up. I'm going to kind of push that stomach and the spleen up a little bit and move these intestines and pancreas over to the side. Here's the tail of that pancreas. If I can, I'm going to pull it off from that peritoneum right here still. So there's the tail of the pancreas. I'm going to kind of lift it up and over. There's that adrenal gland that we saw in lab number 1. I'm going to start to clean around this. Okay, I'm going to use the probe and I'm just going to start to kind of clean and break through this peritoneum. And I see 2 branches emerge. Okay, one is an upper branch, more superior, right here. I'm going to put the probe under it, moving it back and forth. Now again, hopefully in your pig that you're dissecting, it's going to be pink. And in mine, unfortunately, they did not stain well, so mine looks white. So it may look white, gray, or pink would be the best case scenario. But this little guy right here branching off, this is called the celiac trunk, okay? Celiac trunk. This is an artery. This artery is actually going to feed a lot of your abdominal organs. It's going to branch to the liver. There's a hepatic branch that goes to the liver. There's a gastric branch that heads to the stomach. And then there's a splenic branch that goes to the spleen. And that's what keeps those organs oxygenated. We're not going to go that far to find those branches. We're just going to do the main trunk right here. And that's called the celiac trunk. Okay, and it is an artery. It's coming off the abdominal aorta. Now, as I go inferior, there's another branch right here. I'm under it. He's pretty big, a little bit bigger and thicker. This is known as the superior mesenteric artery. So celiac trunk, superior mesenteric artery. Now as we come down, there's going to be branches that go to the kidney. So here's my kidney right here. There's renal veins and renal arteries. Got more lymph nodes. Just kind of pull these lymph nodes off. Okay. The big blue one is pretty easy. That's going to be a renal vein. And then the white one, again, hopefully yours ends up being pink, but mine is white. That's the renal artery. Okay, so renal vein to the left kidney, left renal vein is what we would call that. Left renal artery is what we would call this. And then there's the same over on the right side. If I roll the intestines over to his left and do some more cleaning down here of that peritoneum, kind of off the kidney, you can see a big renal vein right here. That would be the right renal vein right here. And that artery is probably kind of hiding back up behind that since that vein is so thick. Probably a little bit difficult to see that artery, but it's going to be there. It's probably kind of hiding behind it. Okay, now as I come on down, more little lymph nodes. Just kind of peel those off, get them out of the way. Okay, we're going to get down here closer to the inferior region, close to that pelvic cavity down here. And we're going to start to see this abdominal aorta branch off. Okay, here I go. Continuing downward, going inferior down here. Now you start to see 2 branches come off the inferior region, the lower region of the abdominal aorta. This first one right here, I'm going to get under it. I can break through that membrane there. There we go. This guy right here is known as the external iliac artery. Okay, this specifically would be the left external iliac artery. There's one on the right. If we continue to clean, it's kind of down in there. Maybe you can see it as well. I'm going to try to get the probe under it. Right there's the right external iliac. So left external iliac, right external iliac. And then you'll notice there's another branch right here, more medial. That's the umbilical arteries. If we follow it, it kind of dives in through this what's called an inguinal canal right here, and it reemerges on either side of the bladder. If I flatten the bladder out a little bit, you can see there's a set of arteries here, and then there's the other one here to the set, okay? So I've got left, this is called umbilical artery, by the way. Left umbilical artery, right umbilical artery. That's here. And it's coming from this lower branch right here. Now, there is an umbilical vein. We snipped it at the beginning when we first opened up our pig. The umbilical vein is right here, and you can see the rest of it right here, coming off the liver. Well, let me move him down a little bit. There we go. So right here. That's the umbilical vein. It was attached to that urinary bladder right here. Okay, now lastly, we have the femorals. So if we continue down here in the leg and continue to follow this external iliac artery right here down in the leg, we're going to see two branches. And those two branches are the femoral arteries. So all I did was I followed that external iliac artery, this guy right here, that first branch down here in the inferior region. Follow him around. There he is, right there moving down. He's going to branch, okay? The branch that goes a little bit more lateral, kind of out to the leg, that's the femoral artery, okay? You see it right here, femoral artery. And then there's another branch that goes medial, inward. There it is. It's just got some fascia maybe over the top of it, some kind of connective tissue there. Just going to try to trim that off so you can see the vessel a little bit better. There it is right here. This is called the deep femoral artery, okay? So femoral out here on this side, right there, and then deep femoral right here on this side. And these two branches come off the external iliac, which is this guy right here coming down. Now lastly are the two nerves you need to be able to recognize, the two nerves. You have vagus and phrenic. So I'm going to slide them back up a little bit here. The phrenic nerve feeds the diaphragm. It's what's going to connect and allow communication between your brain and your diaphragm so that your diaphragm contracts during breathing. So I'm going to lift up the heart a little bit, kind of move these lobes of the lungs over, and you see that inferior vena cava, that big blue one. Well, in the connective tissue of that inferior vena cava is the phrenic nerve. Right here it is. Okay, it's just going to be a very thin, kind of white, stringy structure right there, phrenic nerve. And then for the vagus actually is going to head down past the heart into the abdominal cavity, but we're going to locate it and name it up here in the neck because your vagus nerve runs parallel right beside your carotid artery. So up here in the pig, I'm on the left carotid artery right here. See that right there? If I just do a little looking around the side, you can actually see a little string. I'm kind of cleaning that tissue off to separate it out. There's a little string that's running right there. Actually, let me pull it on the other side. Might be better. More lateral to it. Okay, there's the string. I'm going to put the probe under it right there. That's the vagus nerve. So vagus nerve is here. And if I go, I'm just going to flip my probe a little bit. Right here is the carotid artery. So there's our left common carotid artery. And then right beside it is that vagus nerve. So the vagus nerve and the phrenic nerve are the two nerves that you need to be familiar with and be able to recognize.